So this is our first official meeting, breakout session of our global convention. That's exciting, right? And we're going to have some amazing announcements, some amazing things we're going to talk about. And it's not hyperbole when I say it's going to blow your mind. It really is. We've been working on some things for a long time as a science team. The Scientific Advisory Board. Board members, where are you? Raise your hands. There we go. We have Dr. Lacey, Dr. Sabo, Dr. Baker, and I see Dr. Snyder out there talking with people, being the kind-hearted soul that he is. So raise your hands for medical professionals here in this meeting. Okay, wonderful. You know, one thing that I'm really surprised isn't the right word, but I'm excited about is the amount of medical professionals that are here with us. I've been in this industry a long time, and I have never been with a company in an organization that has as many medical professionals as we have. That's a big deal, right? And I'd like to talk with, it'd be fun if I could talk with each of you and learn from you what made you be attracted to 3, what made you join 3. You don't have time for that. But I suspect it has something to do with the science. I'm really proud of the science that we have. And so, who's new to 3 here? Hasn't joined or new to 3? Okay, good. Have a few of you. A lot of you, actually. So, what I want to do today is to explain to you why 3 is powerful, why it can transform human health, and why it's something that you can, as a medical professional, you can use in your system, in your practice, in your methodology to transform health, okay? Does that sound good? Yes. Okay, so to get started, I'm going to talk about a few things, and then I'd like to give some time for a question and answer, okay? And we'll do that, maybe the last 30 minutes or so. So, what you need to know about 3 is it all comes down to one word. One word. Molecules. It really does. Molecules, molecules, molecules. Here at 3, we love our beautiful molecules. Who here took organic chemistry? Yeah, okay, all right. And keep your hand raised if it was your favorite class of all time. Okay, a few of them. Yeah, most medical professionals, when they learn I'm an organic chemist, they proceed to tell me some horror story, right? About how their OChem class was the worst, and it was terrible, and they barely passed, and whatever. I was an OChem professor for 7 years. I love organic chemistry, right? If we had time, we'd get up and draw chair structures. Who wants to draw chair structures? You remember those? Resonance forms. Who remembers drawing resonance structures? Oh yeah, isn't that beautiful? Covalent bonds, ionic bonds. Yeah. Density function theory. We can talk about all sorts of things, SN1, SN2 reactions. Remember those? Yeah. Some of you are like, I came here for a good time. I don't want to have PTSD, right? Now I'm going to be up at night, convulsing. But really, it comes down to molecules. The human body is made up of what? Molecules, right? Proteins, carbohydrates, fats. They're molecules. You have macromolecules, proteins, fats, carbs, complex carbs, right? Where you have repeating molecules that are strung together in a line. You have DNA, RNA. It's made up of molecules, right? Nucleic acids, ribonucleic acids, deoxynucleic acids. And then you have vitamins, minerals, right? Made up of molecules. What's your favorite atom, by the way? You have a favorite atom? Gold. Well, my favorite atom is carbon. Carbon, yeah. Carbon is the building block of molecules, right? The lowly carbon. It's a beautiful molecule because it can accept 4 electrons to make covalent bonds. As we talked about, covalent bonds. The sharing of electrons, right? This allows for stable structures that form the rigid framework, not only of the body, but of human health. So when we started this company, And Daniel and I were talking about what we're going to do to be different, how we're going to transform health in new, powerful ways. It all starts with molecules. To give the body the molecules that it needs, because the body performs millions of chemical reactions every single second. And these reactions, in order to function, what do they need? They need molecules, right? In order for those reactions to happen, you need enzymes that catalyze reactions. Are enzymes molecules? You bet they are, right? And for reactions to happen, right? You remember our reaction arrow in Chem 101, right? A plus B, arrow, C plus D, right? A and B, what are they? They're reactants, they're reagents, they're molecules. So we need molecules. A body is a molecular machine. It needs molecules all the time. We need to feed it molecules. And where do we get molecules from? Our food, our diet. That's the number one source of molecules, right? Where else? Plants? Yep. Where else? Breathing? Yeah. When we take supplementation, those are molecules, right? Pharmaceutical drugs that you as medical professionals prescribe to people, are those molecules? Yeah, absolutely, right? Those are molecules that are made, a lot of them are made synthetically. And you know, a lot of people come up to me and they're like, synthetic's bad, right? Ooh, synthetic, terrible. No, I mean, I was a synthetic chemist for a while. Synthetic is not bad, synthesis. I mean, the idea of building its molecules, right? Building a new molecule, that feeling that you get when you make a molecule that has never been made in the universe before. Oh man, you go to like SciFinder, there's a database called SciFinder where you can type in you can draw a molecular structure and it'll tell you if it's in the database or not. I remember August 2001, I made a molecule in a lab and I typed it into SciFinder and it showed no results. Oh, I can still remember the rush, right? And I just said to myself, Gubler, you just made a molecule that has never existed in the universe before. And I called my wife. I'm like, Jane, I made a molecule that's never existed. She's like, you're weird. But anyways, it was a really cool day, right? So synthetic molecules are fine. There's a few drawbacks to them. What are some of the drawbacks to synthetic molecules?
Side effects.
Side effects, yeah. Because synthetic molecules, when I worked for pharma companies, we made synthetic molecules, pharmaceutical drugs. And pharmaceutical drugs are powerful, but they're designed to bind to enzymes so tight. Bonding dissociation constants, KDs. Who likes KDs? I love me a good KD, yeah. Nobody is. Oh, there we go. Patrick, all right. Bonding dissociation constants, that's basically talks about how tight a molecule binds to its receptor. And pharmaceutical drugs, you want a KD that's nanomolar or picomolar. You want it to bind so tight that it's not coming off. You basically want it to be a suicide inhibitor. Yeah, isn't that a cool name? Suicide inhibitor. It comes on and it doesn't come off. And that's how a lot of pharma drugs are designed, because they need to elicit a response immediately, right? You're in this death spiral and you need to pull it up. Right? So you need really tight binders. The thing about molecules from plants is they're not nanomolar inhibitors. They're not picomolar inhibitors. They're micro, or sometimes even millimolar inhibitors. And that's because they're designed to pop on and off of the body. So it's like gently guiding the boat into the shore. That's what molecules from plants are designed to do. Now, pharmaceutical drugs. What percent of pharmaceutical drugs come from plants? Are plant derived? I heard it.
40%.
About 55%. Now, when you go to cancer drugs, that goes up to like 60. So half of all the molecules, beautiful molecules that you doctors prescribe, come from plants. And I remember one day I was tasked to design a drug, and they gave me this huge dossier. They sit on my desk. You're to design this drug, and it needs to do whatever, and here's all this information. And as I was flipping through the information, one of the molecule, there was a beautiful molecule, right? I was flipping, beautiful molecule, right? So I stopped, looked at the page, and it said, so your I was designing HIV integrase inhibitors. And they said, well, our research team has actually found that there's this molecule, what is it, dynamycin 1? I can't remember what it was, maybe dynamycin. But they were like, here's a molecule from a plant that already does that. And I'm like, and for me, you know those times in your lives where something hits you like a load of bricks, you can see things clearly, and you can still remember those to this day, right? You can remember how the air smelled, you can remember, just bring it back, all the sensory things come back. I remember sitting at my desk, and I was eating peanut M&Ms, because I love peanut M&Ms. That's what I used to eat when I was thinking. I don't do that. But anyways, I used to be an addict. I'm clean now. But I remember thinking to myself, Gubler, why are you here making a synthetic molecule, trying to design a synthetic molecule, when there's already a molecule from a plant that does that? Duh. Like, what are you thinking? And from that time on, I switched. I left synthetic chemistry and I moved to natural products chemistry, the study of natural molecules from plants and their ability to change. So for us here at 3, it's all about molecules. And let me see if I can turn this around without throwing it off the stage. Yeah! Oh yeah! Isn't that beautiful? Yeah! Molecules, right? Silibin and A. Look at that. Look at that. Yeah, that 6-member furan ring, this difuran. Ooh, we could draw it. Let's have someone come up and draw resonance structures. But anyway, so silibin and A for purifying. Beautiful product for supporting health of the liver. This has really powerful epigenetic properties. It binds to different genes. Look at this quercetin. Who likes quercetin? Yeah! Quercetin, beautiful molecule. Quercetin is a master regulator. It's like one of those molecules that does everything, you know, like sports, those 2-way players that can do offense and defense. Quercetin, it's a quorum sensing inhibitor. Who knows about quorum sensing? Yeah, quorum sensing is the way bacteria talk to each other. They chat with each other, right? They share conversations. How do bacteria talk with each other? Molecules! It's all molecules. Everything, right? They shoot molecules back and forth. And one bacteria picks it up and they analyze the molecule. And they send it back. They send it back. They send it back. And it's like texting. So that's what molecules do. And molecules, bad bacteria, when they're chatting with each other, they can get excited. They can start, chatting back and forth and whatnot. And they get to the point where they start to grow exponentially. And when bacteria, viruses, by the way, use the same thing, quorum sensing technology. When they get excited, they start chatting. That's how they overwhelm the immune system, and that's how they get sick. So there's molecules, and quercetin's one of them, that inhibits quorum sensing. It inhibits the ability of bacteria to talk to each other. And when bad bacteria can't talk to each other, they're silent and they die. Good bacteria use molecules to communicate as well, but it's a different language. It's different molecules. Quercetin doesn't inhibit good bacteria communication, just that. So, quercetin, great molecule. Ooh, look at this one here, mamorticin. Oh, beautiful molecule. Have you seen that before? Oh, that's gorgeous. Look at that. Look at that 4-member ring. Do you know you've got the fuse 6665? Oh, that's sweet. What a great structure. And you know these wedges and these dashes, do you know what that is? Do you remember? Stereochemistry. What? Stereochemistry. Yeah, you remember? Functional gravitation. You have bonds that are coming out into space and bonds that are coming back, right? 3-dimensional structures. Because structure determines what? Function. Yeah, over here, good. Structure determines function. So it's this 3-dimensional space that allows these molecules to do what they're doing. Isn't that cool? And mamorticin, beautiful 3-dimensional structure. Mamorticin is actually from bitter melon. And bitter melon is one of the ingredients in our Vitality product. Mamorticin, powerful at regulating blood sugar levels, powerful at regulating blood insulin levels, powerful epigenetic regulator. Okay, come down here, phosphoric acid. That's a beautiful molecule. Look at that. Isn't that freaking gorgeous? So you have a 6, 6, 6, 6, 6 fused together in cis configurations. Boswellic acid, really good at supporting the anti-inflammatory process of the body. Who here likes Revive? Who here uses Revive? Yeah! Revive is a powerful product that reduces inflammation. And the workhorses of Revive are curcuminoids, which we know about, and boswellic acids. And I actually, if I was forced to choose, I'm tired, if I was forced to choose between curcuminoids and boswellic acids, tough choice. It's like LeBron and Jordan, you can choose, But I would probably go with my boswellic acids. I honestly would. They're powerful. I know that's blasphemy to choose boswellic acids over curcuminoids, but they're really powerful. They're kind of unsung heroes here. Resveratrol. Who knows resveratrol? Classic molecule. Master gene regulator. Great for longevity, anti-aging. That's why we have it in our Eternel product. And then, whoa, the granddaddy of them all. Look at that bad boy. Purely halogens. Look at this connected together. You have a sugar molecule in here, a saccharide. You have fused rings. Look at this gorgeous structure here. It's four rings together. Punic halogen is one of the molecules that allows the body to produce collagen again, right? So the reason why our collagen product would take a 10 days on, 20 days off, how many other products do that? How many other products teach the body how to make collagen again? None in the industry. Our product does. Why? Molecules, baby. Punic halogen. Yes, punic halogen. And a few other molecules that we don't have time to write down and talk about. But this is one of the workhorses. So when your body produces collagen again, because you take collagen, you should say, thank you, punic halogen. I love you. I am grateful for you. Yes. In your morning mantras, punic halogen. I mean silly, But really, to be serious, it's all about the molecules. These molecules are what gives the body life. And if you're serious about improving human health, then you need to develop powerful combinations of molecules that have never been seen before in the industry. That's power. If you can do that, then you have power. You have an advantage over every other company. Now, the thing about the supplement industry is we are in a molecule malaise. We're all using the same molecules, right? When you look at a formula, and you turn it over and you look at the ingredients, they're all the same, pretty much. They're all using curcumin, they're all using grapeseed, what else? They're using the same molecules. And if you're using the same molecules, are you different than anybody else? No. Can you have more power than anybody else? No. You're the same. So for us, we're passionate about molecules. And so our approach, turn this around again, we're not hurting myself or anybody else. So our approach starts with exploration, right? So the 3 pillars of our scientific approach, as a lot of you know, number 1, exploration, number 2, curation, and number 3, absorption. And it's all about molecules. Exploration, to find new molecules. And that excites me. And we have our exploration efforts that we do at 3. Part of which we show by our Explore with Dr. Dan series, where you can actually see us out and about in nature, finding plants, bringing them back to the lab and analyzing. And we have something really exciting to say about exploration this weekend. It's going to be really, really exciting. Dr. Baker, why don't you come up here and talk about why exploration is... I'm putting him on the spot here. Dr. Baker, why don't you come up and talk about, just like 2 minutes, about why exploration is such a...
Thank you. Thank you, Dan. Thank everybody for being here, by the way. This is an awesome crowd of all science people. This is pretty awesome. And when you were up there talking, I really was thinking, this needs more drugs or rest. but you're right. This is pretty exciting. But exploration, the skills that this man has at going out into these areas, and we will bring up some things in a couple days I think you'll find interesting. But when he's able to go out into these areas to explore in areas that maybe haven't been very much before, finds a plant that's unique, a lot of them are, and then takes it back to the lab people and is able to extract out some of the most unique molecules that we've ever seen. So this is pretty amazing, and so that's why exploration excites me. Curation obviously is a big part of it. Absorption is huge. We've always talked about absorption, but the exploration part of this triad of things we have up here is vitally important, and that's why we're so blessed to have someone that's so good at exploration as Dr. Dan is. So again, thank everybody for being here.
Let's give another hand for Dr. Baker. On the board, we all have our different skills and strengths. Dr. Baker is my analytical chemistry buddy. We talk about HPLC and mass spec and stuff like that, and we geek out a little bit. But exploration, finding new molecules from plants. Are there new molecules out there? There's hundreds of thousands of new molecules out there. They're discovered every day. So if you want to join my journal club and we'll geek out, there's a journal called the Journal of Natural Product Chemistry, where you can look at that. And each day they discover new molecules. And I've published some papers in there in the past, but there's new molecules that are being discovered all the time. Molecules that can transform human history, right? There's hidden treasures. When I was a little boy, I always loved treasure hunting, right? I went through a kick where I was an archaeologist. I loved archaeology, finding things, right? And there's this little boy in my neighborhood. You see, Dr. Baker, same thing. There's this little boy in my neighborhood that is an archaeologist as well. And his mom asks us neighbors, if you have anything to donate for Holden, and we give things, and she buries them in her backyard, and he goes and finds them. And it's so cute for him to be like, whoa! I gave him an old watch and stuff, and he was like, look at this watch that I found. But I love discovery. And it just thrills me to think of plants. Even in these hills, these mountains, you see the trees on these mountains. Here in Utah, there's a plant that I've been studying that has some really cool molecules that no one else has found before. Just here in Utah, right? And there's molecules from plants that are growing on the side of the road that are weeds. In Hawaii, there's this plant that's it's called a vampire plant, but it's considered a weed. They try to kill it. They put weed killer on it and whatnot. But that plant produces a molecule that has ambient-like properties. Like ambient and lunesta, it has the same properties without the crazy side effects. From that plant. Isn't that cool? That's freaking amazing. And so, there's so many molecules left to discover and explore. And how many companies are doing that? The pharmaceutical industry used to do that. Back in the 40s and the 50s and the 60s, they would collaborate with botanists, and they'd go to the Amazon and different places and catalog plants, and they'd do some analysis, HPLC, DART MS, things like that. And they look kind of high level for molecules. And indeed, the pharmaceutical industry uses these libraries, these natural product libraries. That's why, when I was doing that, when I was developing that HIV integrase inhibitor, they gave me that molecule. That's from their database. But they're not doing that anymore. They're turning to AI. And they're turning, we'll see how that goes. They're turning, I don't know about that. They're turning to AI. They're turning to combinatorial chemistry. They're turning to different things where they're just randomly, and I don't get it. I don't know. They're like, wow, we could just randomly develop this molecule. And it's well, if you want to drill for oil, you usually start where oil has been known to be found, right? Rather than just nowhere. Anyways, whatever. But the bottom line is they're not doing it. Supplement companies, are they exploring? Are they doing natural product isolation, No. So that gives us a unique leg up. Because if we find a new molecule, and if we analyze that molecule for its properties, and if it turns out that that molecule has a health benefit for, I don't know, bone health, joint health, skin health, heart health, brain health, whatever, and we use that, and that molecule has more powerful properties in our clinical studies than other molecules out there, and we put it in a product that you have in your hands that you can sell. What does that mean? We're gonna be rich! Okay, but we're Patrick, bring it down a level, because we're healthcare professionals. Right? We're virtuous. We are looking after the common good. Okay? Now we're on the same page. But really, as a medical professional, if you could have something like that you could use in your clinic, that you can use as a proactive wellness measure for the people that you interact with every single day, what does that mean? What's that? It's a game changer, right? Really, it's out of the insanity cycle, right? The definition of insanity is doing what? The same thing and expecting a different result, right? It's ridiculous. And right now, the supplement industry it's firmly entrenched in this insanity cycle. We're doing the same thing, we're using the same molecules, we're using the same manufacturers. Marketing, the story's a little bit different, we're trying to market it different, but come on, we can see through that stuff. I mean, give me a break, right? So we're in this insanity cycle. Now, if you're able to find a new molecule that you can use, what happens? Boop, you're out, right? You're out of that insanity cycle. You're now playing in a different space. You're playing in business strategy what they call blue ocean, right? An area where no one else is playing, right? In the insanity cycle, in that analogy, it's red ocean, right? Everybody's doing the same thing. Have you ever gone to the beach where, you know, there's like trash floating in the water and everybody's there? You try to like set your towel down and you're like stepping in between people, right? And you're like, yeah, my towel's right there, you know, don't touch it. And you go into the water and you have to like swim through people and, you know, someone's armpits in your face. Yeah, you know, that's red ocean. Everybody's there. Everybody's playing in the same space. Blue ocean. You own it. You and your family on this beautiful beach, miles away, no one there. It's beautiful. You kayak out to the island. You by yourself, have fun, play together. That's blue ocean. You have power. You own it. And year 3, through our molecular strategy, we are using blue ocean technology, new molecules. Okay? Does that make sense? Yeah. And you're going to hear about exploration, like I said, this weekend. And it's going to be cool. It's going to be fun. Okay, curation. So now that we have these new molecules that we've discovered and explored, and they're ours, we own it. How do you own a molecule?
Yeah.
That's kind of weird, right? How do you own it? You patent it. But can you patent a molecule that's already existed? Patent examiner were like, you can't own that. It's like there, right? Nature owns it. Well, you can own the extraction process. You can own how you obtain it, how you refine it, how you purify it, and you can own how you combine it together. That's when the power comes, where you take this new molecule and you combine it with other molecules and you put them together. And that process is called curation. You're like a Michelin star chef. What makes these amazing French restaurants or top tier restaurants in the world the best is they use the best ingredients, and then they also use the best know-how to combine things together in power, right? That makes your taste buds sing. It's that curation approach. So the same thing here. What we do is we put these molecules together in a fashion, in a proprietary blend combination that gives power. Now, when I say gives power, what does that mean? Well, one of the things that our products, one thing that they do is they regulate something called epigenetics. You remember epigenetics? Okay. What is epigenetics? Lifestyle can affect epigenetics, but what is epigenetics?
Turning on and off.
The turning on and off of what? Genes. Switches, genes, right? A gene turns on and turns off, right? You have things like DNA methylation and different things like that that unravel DNA. Isn't DNA amazing, right? If you were to take DNA from one human cell and you were to stretch it out, how long would it be? 6 feet long. Isn't that nuts? Yeah, 6 feet long, my wingspan. If you were to take DNA from one cell, pull it out, 6 feet long. And how many cells do we have in the body? Yeah, 35 trillion, you know the numbers, but there's trillions of cells. So if I was to take all of the DNA from all my trillion cells, pull it out, 6 feet, tie them all together in a knot, it would go from here to the moon and back 3 to 4 times. Right? That's the amount of information that we have. So this DNA, it's genetic code, genetic information, right? And we have genes that determine color of our eyes, color of our hair, etc., right? But there's also genes that control the chemical reactions of the body. Those millions of chemical reactions, they're controlled by genes, these switches. And these genes are like instruments of a symphony, right? The strings, the harp, the tuba, the bass, whatever. The guitar, not very cultured. Shane's like, we're going to go to a symphony. I'm like, really? Anyways, we have these instruments here, right? And these instruments can play beautiful music. And these are the genes. But what controls the genes? Right? In this analogy, in our symphony, the conductor, right, controls the genes. And we did go to a symphony the other day, and it was beautiful. It was at Deer Valley in Park City. It was beautiful. And the conductor, I was always just, he was like doing things and making these motions. I was like, wow. But it sounded beautiful, right? It was a Utah Symphony. It sounded amazing. But the reason why it sounded amazing was because of the conductor doing all those things, right? So in our analogy, we have our genes. What's the conductor? Molecules! Molecules! Yes! Molecules are the conductor. I was looking for my big orange thing. It's gone. Molecules are the conductors. So what's really cool is molecules from plants, like quercetin, and ellagic acid, and curcuminoids. These are the conductors. They're conducting. Now, is it any wonder why human health has struggled the last 10, 15, 20 years? Because of the modern processed diet. What is the modern processed diet pushing out? It's pushing out all the nutrients. It's pushing out the molecules, the vitamins, the minerals, but most importantly, the phytonutrients, these small molecules from plants. It's pushing it out. They're gone, right? When you eat a taco, right? How many phytonutrients does a taco have? Right? A hamburger, right? Maybe that little lettuce. Yeah. Well, lettuce has cool phytonutrients like lutecin. Luteucin's a bomb molecule. You can draw it if you want to. Luteucin's great. It's a great molecule. But if you're taking one piece of wilty lettuce on a burger, how much luteucin are you getting? Come on, right? So it's this molecular drain. All of the molecules are gone. They're not in our diet. And that's one of the reasons why we're having problems. Because gene expression then is not regulated. And when gene expression and the chemical switches are AWOL, what happens? Obesity, diabetes, all these things that you as medical professionals try to help manage and prevent. One of the major reasons they're happening is we're not getting we don't have master conductors in our diet. Dr. Schneider, do you want to come up and talk about epigenetics and your thoughts on epigenetics in general and 3?
All I could hear back there was the word molecule. Is that you?
I think that's about all I can.
Dr. Schneider is the chair of our SAP. He leads us with
By epigenetics, anybody heard of it? Yeah, so everybody's heard of it. So what controls epigenetics? Well, molecules do. but a lot of your behavior controls epigenetics. So some of you have heard that your genes are what determine right? What color your eyes are, whether you're going to get breast cancer like mom, whether you're going to have heart disease, whether you're going to have depression. All right. So we know that the genes definitely do play a role in how this life of ours sort of proceeds. But it's the epigenetics that tells which genes are turned on and which genes are turned off. We are in the business of turning on the good genes. And we know that we can do that because we have research which has shown that our products or our molecules, and not only the molecules, but the combination of molecules, which Dr. Dan has formulated, work in such a way that it acts in a way that allows for your good genes to be turned on and the bad genes to be turned off. Now that's epic. Now we actually understand that you aren't necessarily destined to fail because of what your parents or your genes determined. You can affect them. Now, we know that what you eat, which is the business that we're in, right? I mean, we are here talking about nutritional supplements. We're going to put them in our body, and yes, they do turn on the good genes. But you can also alter which of those genes. Anybody know what else affects your epigenetics? Sleep. Sleep does. Sleep is huge. What else? Stress reduction. Okay, so one of my favorite things to talk about when I talk about epigenetics is I do believe that there was a master creator who designed us to love. And we know that stress reduction, love, charity, volunteering, those extend your life. Good relationships actually extend your life. So how do you like that? So here we are, sort of this cosmic floating around on this thing called Earth, and God has destined us to have relationships that are positive, and He's going to reward us by allowing us to live longer and healthier. So it's a beautiful system. So we know that food, we know that exercise, we know that sleep, and we know that love can turn on your good genes. So do all those things. And we're so happy that you're here. Did I talk long enough? All right. So anyway, I wish we had a bigger room. I was out there and I heard maybe 4 of your words, but anyway, they really were extraordinary. Yeah, extraordinary. So anyway, we're glad that you're here. We're looking forward to having a lot of fun, and we get almost 3 days together. So anyway, take care, y'all. It's good to see you.
So we have clinical studies, like Dr. Snyder said, showing that our products can regulate key genes. Who's heard of GLP-1? Woo! Oh yeah, right? GLP-1's in the news a lot. What if I told you we have clinical data showing that our products, a few of our products, upregulate GLP-1? Would that be cool? Yeah. Vitality and Revive upregulate GLP-1. BDNF, who's heard of that? Yeah. Brain-derived neurotrophic factor. Beautiful target, beautiful gene. What are genes made up of, by the way? Yeah, molecules. We're on the same page. BDNF, great at supporting cognitive health. And our products regulate BDNF. NF-kappa B. Who knows NF-kappa B? Sweet gene, right? Talk about being a boss. NF-kappa B, when it comes to inflammation, it's one of these master regulators of supporting inflammation. Our products regulate NF-kappa B, PPAR alpha, SOD1, and others. And how many other companies show that their products regulate epigenetics? I haven't seen it. Have you? And why are we able to regulate epigenetics? It's the molecules. It's the curated approach. Sorry, we're just kidding. Over and over again, we're like, will you stop now? It's about the molecules. But molecules are not beneficial if they're not absorbed, right? And that leads to the third pillar. The reason why we are cellular absorption experts is because we love molecules that much that we want them to get into the cell. We want all the molecules in all of our formulas to get into the cell. Now, when you think about it, there's a lot of molecules. You look at Vitalite, and there's like 40 some odd ingredients in Vitalite. But in each of those ingredients, there are many different molecules. So it's hard to know for sure, but when we run Vitalite through our instruments, they can detect molecules. And one peak represents a molecule. We have over 1,000 peaks. Vitalite has over 1,000 molecules. Isn't that crazy? Crazy good. Exactly. That is crazy good. Eternal, 800 molecules, 700, 600, 900 molecules in each of our products. So when you take our 6 products, which is our proactive wellness system, right? Because we really just have one product, a system that we broke up into 6 different delivery forms. So when you take our system, our proactive wellness system, you're taking thousands of molecules every single day. Is that going to have benefit to the body? Yeah. You bet it is. Is that going to counteract the molecular drain from our diet? Yeah. You bet it is. Is it going to help regulate epigenetics? Yeah. Absolutely. And so that's why we have our 11 different cellular absorption technologies. Now, why do we have 11? Why not just one? Come on, 11? Why not just liposomes? Liposomes are cool, right? They're sweet. I love liposomes. Love me a good liposome. Why don't we just encapsulate everything in liposomes? Be done.
Molecules.
Molecules.
Always say molecules.
Exactly. Because some molecules are too big, they don't fit in liposomes. Some molecules are too small, they leak out of the liposomes. So if we really are serious about molecules getting into the cell, we need delivery technologies, some that help with big molecules, 1,000 molecular weights, some that help with small molecules, like 60, 70 molecular weights, and everything in between. So that's why we use absorption. And we have a really exciting announcement about absorption this weekend as well. So stay tuned for that. Yeah, it's going to be fun. Because we are always looking for new absorption techniques. When you discover a new molecule, a lot of times that new molecule means a new absorption technology, right? Makes sense. So it's all about the molecules. And I hope what I've shown you today is that our products, with our approach, and it's not just our products, but it's our approach. If you're using a different approach, then you get different results. And so our molecular approach that we're using gives different results. Doesn't it? Yep. Who feels the difference when they take our products? If you've tried our products before. Okay. That is the result of our molecular approach. When you try our products and you feel the power of our products, that means that our molecular approach, our system is working. So, in a nutshell, for medical professionals, that's what makes us different. There's no other company using this approach. Now, a molecular approach is actually a scientific approach. It's a pharmaceutical approach. Pharmaceutical companies, they're all about molecules as well. They're all about designing, synthesizing, discovering through synthesis. There are molecules, they put it through safety studies, ADMET, tox studies, they go into clinical studies, and they come up with this molecule that they sell. And they make $12 billion a year for that molecule, right? We're doing a similar approach, a molecular approach. We're discovering molecules. We're not synthesizing them in the lab. We're pulling them out and finding them in plants that have never been analyzed before. And pharmaceutical companies do absorption studies. Do we do absorption studies? We do. Pharmaceutical companies do safety studies. Do we do safety studies? We do. You can see those in our clinical studies. Pharmaceutical companies run clinical trials. We run clinical trials. As a supplement company, do you have to run clinical trials? No, no way. You know? And most companies don't want to. Why would you want to run a clinical study? I was consulting with a company a while ago, and I was telling them that they should really run a clinical. I didn't formulate the product. They had this set of products, and they wanted help scientifically to look at them. And I said, well, you should run clinical trials on it. And the CEO's like, I don't want to run clinical trials. I'm like, man, you really should. He's like, I don't want it. Like, you really should. He's like, I really don't want it. I was like, what in the world? And I was with dinner. I had dinner with him, like a week after this conversation. And he said, hey, I want to, because it's you and I want to talk about this. The reason why I don't want to run clinical trials is I don't think the results will be that good. Yeah, I'm just worried about the results, honestly, right? And as a supplement company, why would you want to run a clinical trial? Just let your marketing machine talk about things and go crazy, right? But we run clinical studies because we don't just want to hope it works or pray it works or think it works. We show unequivocally that our products work. So, with that, I'd like to take any questions if you have. If you have a question,